Welcome to Clinical Lab Chat, part of the MedCore Podcast Network. I'm Chris Wolski, Director of Business Intelligence for CLP, and today I'll be discussing the critical importance of accurately diagnosing neurodegenerative diseases with Dr. Russ Lebovitz. Russ is the CEO and co-founder of Amprion Diagnostics, and prior to his career in biotech, he was a senior scientist and research physician for more than 15 years. Russ received his MD and PhD degrees from the Washington University School of Medicine and is active in a variety of industry associations, including the Alzheimer's Drug Discovery Foundation, the Michael J. Fox Foundation, and the ALS Network. So, Russ, welcome to Clinical Lab Chat. I've been looking forward to discussing this topic with you since we first spoke last week. So I think we're going to cover some really good and interesting territory here.
Thanks, Chris. Really happy to be here today.
All right. And you said you have a little bit of a cold, so those of you that's listening, Russ doesn't usually sound quite so gravelly, but this I think it's just the time of the season, so I think we can excuse that. I've set up our diagnostic discussion in the intro, and I really want to dig into this. But why is it? But I want to back up a little bit and discuss why is it so important to make an accurate diagnosis of a neurodegenerative disease from its onset, or even before the onset of symptoms. And there's a lot of talk about this in various articles I read, and I'm sure you're very aware of that. There's a lot of talk about the importance of looking at neurodegenerative diseases before onset of symptoms. I think there was a big article last week about signs that you may have maybe at risk. So why is this so important?
Yeah, well, thanks, Chris. Several reasons. One, we're talking about the brain here, and the brain has more limited regenerative and repair capacity compared with other organs. So
right.
Very often, once something's damaged, that's it. And the best you can do is stop it. So there's one why you'd like to be early. Another is that the nature of neurodegenerative diseases, and that would include the dementias, the movement disorders, we give them all sorts of names,
right.
But these are very slow progressive diseases. It may, from the time they start, the total course to full-blown disease is often 20 years on average, and they're silent for the first 10 years. So by the time what we would call early now from clinical diagnosis, you've had a creeping, expanding disease, killing cells in the brain. Brain's trying to compensate. When we see early symptoms, we've already lost our ability to compensate because so many cells are destroyed. So what we'd like to be able to do is to have another way other than clinical signs only to be able to know that there's a molecular disease going on during that first 10 years when things are being silently destroyed, because at that point we might be able to intervene and minimize the chance of any signs of cognitive or movement disorders later in life. So early is better in the brain, and particularly for
right.
Degenerative diseases.
Right. Now, there are other tests out there, and a lot of them are more they're more observational, I guess, in some cases. But there's a lot of new blood tests coming up, which are pretty exciting. Now, what Amprion does and is involved with, and we'll talk a little bit more about your test in a minute, but what does Alpha-Synuclein testing bring to the table that, say, blood testing or some of these other observational tests don't? Does it add a level of precision to the testing, or does it bias, or is it buying you some time?
Well, it's a great question. So what we know is that all of the neurodegenerative diseases are caused by proteins that are normally in the brain at high concentration. Over time, in some people, they'll fold into a different shape, and that shape then changes things in the cell. One, you reduce the amount of the normal protein, and you increase the amount of the misfolded protein. So there are a number of these in neurodegenerative diseases. So in Alzheimer's, we talk a lot about amyloid and tau.
Right.
The nuclein is really the major protein associated with Parkinson's disease and Lewy body dementia. lately we've come to see that even in Alzheimer's, almost half, 40% of people with Alzheimer's may also have misfolded synuclein, and it changes the disease in a very significant way. So synuclein is a major player here, and there are other tests. There are tests for amyloid, there are tests for tau, and the issue is that these misfolded proteins tend to cooperate. So you often get more than one. So having a test for misfolded synuclein is a new window into certainly diseases related to Parkinson's and Lewy body dementia and half of Alzheimer's patients. So it's really important.
Okay, great. And does this also help with treatment as well? I mean, you're getting a level of precision. You're talking about kind of a level of precision with knowing exactly what kind of, and you mentioned, I think, about 4 different, what we would call dementias or neurodegenerative diseases. They're all very different. Many years ago, I wrote an article about, I think it was a neurodegenerative disease of some sort. I can't remember the details of it off the top of my head, but it was diagnosed as MS, and they put these, it was mainly men, they put them on these MS drugs, and it was horrible. It was really awful. They suffered really, really quite badly because they had the wrong drugs the wrong treatment. So is that also important, having the right not only diagnosing but having that level of precision help with the treatment side of things?
Absolutely. Anytime we have a treatment, that treatment has a cost and that treatment has risks. It would be wonderful if we had many, many treatments with no side effects. However,
Right.
we live with the side effects, but it is essential that we match the drug or the device with the right disease. Otherwise, it's the cost of not providing the right treatment and the cost of providing the wrong treatment and having side effects with very little benefit.
Right. And how does this, now that impacts the patients directly, of course, but how about like caregivers and just public health in general? We talked a little bit about public health, I think, during our pre-interview. So what about public health and the caregiver, because it's a disease in which you need caregivers, either, people are professionals or your family members to help out. And then, of course, there's the impact on public health
Sure.
as well.
All of this is on the caregivers. They're there 24/7, 365. And so, it's really essential the way that we as doctors and as developers of new diagnostics and treatments help the caregivers is by being accurate, by being early, by helping them use their energy to provide the maximum benefit. So
Right.
they're essential. You can't overestimate the need and value of someone willing to be a caregiver here.
Right. Okay. And now Amprion offers an alpha-synuclein SAA test. Now, how does that work? And is it available? If I went in and I had a family member or myself, I was a little worried about things, about my own health. Is that available to primary care physicians? So how does that
Well,
work? And is it available for us to use?
absolutely. So SAA stands for Seed Amplification Assay.
Okay.
And the reason we're talking about amplification here is that misfolded synuclein is present in fluids at very low concentrations. So to be able to detect it and to be able to say with certainty that someone has the disease, we have to amplify that signal. And that's really Amprion's unique ability here, that we amplify. If there is a signal of one molecule, we can amplify that. If there are no molecules of misfolded alpha-synuclein, there is no signal. That makes it extraordinarily reliable. But because of that, and because these are important diseases, in general, at present, the healthcare system in the US at least, these diseases are diagnosed by specialists, and it would be, in the case of someone with cognitive disorder, it would be a memory care doctor. In the case of someone looking for Parkinson's, it would be a movement disorder specialist.
Right.
So ultimately, that's who orders it now. But our goal is, since the test is so reliable, to push this down. So by the time one shows up at a specialist, one has already had the test. So we're putting it in the hands of neurologists, and ultimately those neurologists may want, when the patient shows up in their office, to have it, and then it would be appropriate over time for primary care physicians. Any doctor can order it.
Okay. Okay. So, and now, is it something that, say, one of our lab listeners, they would be able to add it to their menu, or is Amprion processing the test for the time being?
So it's a proprietary test. Amprion does all the testing right
Okay.
now in our laboratory in San Diego. Any laboratory can do it as a pass-through, and that's very straightforward. On
Right.
our website, which we can talk about in a second, all the information that a doctor or lab director would need is there. And over time, we're working towards developing kits that could then be applied in other laboratories. So I'd say in the future, this could be something that many different lab directors might be interested in, but right now it would be a pass-through.
Right. Yeah. One thing I was thinking about is we're talking. I talk a lot about, regular listeners know this, and people who read the website and the magazine know this. I talk a lot about testing access, and having the ability to be tested for these various diseases. What we have an aging population, and as most Western countries do. What does the menu look like for neurodegenerative diseases in diagnostic testing, just in general? I mean, I just went to I think the last couple episodes I've talked about this. I just went for my yearly checkup. Thankfully, everything was A-okay. And my doctor, gets this. It's on a screen. All these tests that that's recommended. How are we moving to an era when diagnostic tests for neurodegenerative diseases, particularly because of an aging population? This is mainly, we think of a lot of neurodegenerative diseases as old age. I'm using scare quotes. Old age disease. When do we add? Is this going to be? Are we going to see these kinds of tests added to the menu of either things that are done collected in the doctor's office, some of these blood tests, or being referred to a specialist when you get
Sure.
to a certain age?
Well, it's a great question. And as we get experience with the tests and we learn just how reliable they are, and I will say that certainly Amprion's Samplified test, that's what we do every day, is to make sure that its sensitivity and specificity are extraordinarily high. But there are others as well. Right now, we do it when people show up with symptoms. I
Right.
think we're moving now towards people who have had a family history
Mm.
or have a known genetic defect that increases their risk. And then eventually is not 20 years, I think in the next 5 years, we'll see a lot of these tests being a panel related to aging. That
Right.
just like a colonoscopy, one
Yeah, I
will
was
get
just thinking that. Yeah. Yeah.
every 10 years.
Yeah. Yeah. Well, and you were talking, and what struck me with that was, what kind of came to me is because you're talking, by the time people are being diagnosed, you're 10 years on that road, that 20-year road, I guess. Talking about the, kind of the, I guess, classic journey. You're 10 years on a 20-year road. You've lost 10 years.
Oh,
What?
absolutely.
No.
Yeah, that's what
Yeah.
we want to do. We want to catch it in that first 10-year period, preferably in the first 5 years,
Yeah.
and then to have treatments either by drugs or medical devices, or it might be lifestyle changes. We need things that
Yeah.
really work. Some of the less aggressive and less invasive are likely to work best at early
Right.
stages with no symptoms. So diet and exercise, when they will work best, is when there's only a biomarker and no evidence of serious brain damage. So
Right.
absolutely, that's
Yeah.
what we're looking
Yeah.
for.
Well, it's like any, any sort of, disease, diabetes, or, joint issues, or there's that article that came out a few weeks ago about, you have these two moments, your late 40s and early
Yep.
60s, where,
Yep.
if you either got to get moving and take charge, or you're going to start to decline. It just seems like that seems a logical way to go. Now, I think what's important, we talked about this in the pre-interview, and I think we talked when I was approached about this podcast. Amprion did also, more importantly, received a letter of support from the FDA for this test. Now, why should that be? That's really great. You're getting some official recognition or support, but why should that be important to our clinical laboratory listeners, and maybe some of the pathologists and others who are listening to this?
Sure. Any test needs independent validation. That's how we determine what's important. Our test really was shown to be extraordinarily effective through collaborations, for example, with the Michael J. Fox Foundation,
Right.
who had collected lots of patients and ran a number of blinded studies with our test. And so through those efforts, there's a lot of peer-reviewed data out there. I'd say a ton, tens of thousands of patients. And in many cases, what makes this test so important is that of the patients that were tested and went on, unfortunately, to die, but to be autopsied, the test very accurately predicts the pathology. And that's been the standard for a long time. So based on that data and the unusual accuracy of the test, even early, a number of independent agencies went to the FDA and said, we would like this test to be used more frequently in clinical trials. We want people to be aware. We want it to be the gold standard for drug development and even prevention for new therapies and preventative interventions for synucleinopathies, for
Right.
Parkinson's, Lewy body dementia, a number, as I said, 40 to 50% of Alzheimer's. So as far as
Yeah.
we know, the FDA reviewed the data and issued a public letter, but we didn't approach the FDA.
Right.
This was third parties looking at all the published data.
Right. Okay. Well, it gives you credit. It gives the test a lot of
Correct.
credibility, for sure.
Yeah,
Yeah.
we're happy about it for
Yeah.
sure.
I'm sure.
But it's not about us. It's really about the objective accuracy of the test.
Yeah, absolutely, absolutely. Now, in a previous episode, regular listeners may have listened to this, hopefully. I spoke about how we're entering a new age for neurological health. From your perspective, that previous guest said we were. From your perspective, are we entering a kind of a new golden age for neurological health?
Absolutely. Yeah.
And why is that?
Well, because we're learning from other areas of medicine where we've made great strides. So, really heart disease and then cancer.
Right.
So we're learning that it's a molecular diagnostic. It's a biomarker that is about the disease itself that tells us where we are. It can be very accurate, it can be early, and those biomarkers often are the targets for new drugs, and they
Right.
get mapped. So the whole idea of companion diagnostics, where you do a test, it tells you if you have a problem, and then you get a drug that's specifically aligned with that biomarker.
Right.
That is clearly where we're heading here. I'd say that for at least 3 of the major proteins that cause neurodegenerative diseases, amyloid, tau, and synuclein, were there. There are probably other 5 or 6. And ultimately, where we're going to end up is personalized medicine,
Yeah.
where for each person, we're going to be able to say, here are the proteins that are causing your disease. Here are the parts of the brain that are being damaged right now. Here's where it's heading. And here are the treatments that counter each of the causes that we've identified, because it's probably going to take a combination of therapies which were pioneered both in heart disease and later in oncology.
Right.
I think we're following the very successful playbooks.
Yeah, and gone are kind of the days. Many years ago, I covered radiology, and we are really, I think, gone from the days when you just basically, hit patients with everything you've got. Now it's so targeted and precise, and then the benefit is you aren't damaging healthy tissue, and quality of life's better, and longevity is a lot better as well. So certainly in all those cases, it sounds like that's where we're headed. So okay, now you talked a little bit about 5 years ahead a couple of questions ago. Let's talk about 10 years ahead. What does 10 years ahead look like for neurodegenerative testing look like? Do you think?
Well, I do think that we'll have characterized all of the major causes. And again, so far, all of them are related to one or more misfolded proteins. That seems to be what happens to us when we get diseases at elderly ages. Other things may break down earlier. Cancers are caused by mutations. These diseases are caused by proteins that are very abundant, that just have this capacity to fold into toxic shapes, and those shapes damage cells, and then they remove the normal protein. That is a really important mechanism of disease that wasn't even recognized until probably the 1980s. And the index disease for all of the neurodegenerative diseases, interestingly, is mad cow disease. We learned
Interesting.
so much from that.
Yeah.
And really, it was the idea that a protein folding into a different shape could cause a disease, and that it could replicate within the brain and it could spread a disease. And that's really where we are with Alzheimer's, with the amyloid theory, and tau. Those are just misfolded proteins. Synuclein is another. In
Right.
ALS, it's a protein called TDP43. And there are several others. So where we're heading is to have, you'll be able to get a list of all of these, and which ones, hopefully none in your case, are
Hopefully.
and then we can counteract each of these. And I really expect that will happen within a few years. And it might not only be, drugs. Drugs will counteract the cause. If we have damage already, we have some remarkable devices that might be able to restore some of the damage. So we may increase the ability, once we stop the disease, maybe we can cause the brain to regenerate, or certainly at least put electrodes in and stimulate to make up for the damaged region. So
Right.
very optimistic, and that's really what the 10-year looks like.
Yeah. Wow. That's cool. That's really something. The mad cow thing is really fascinating. Well, unfortunately, though, we've come to the end of our time. Russ, thanks so much for taking your time to discuss your really exciting test and all these developments that are happening. I think it's giving us some bright news. I hope that listeners appreciate that, as I do. I've been looking for some good news, and I think this is some really good stuff. I also want to thank you, the laboratory audience, for listening. Look for more episodes of Clinical Lab Chat in the future, and visit us online at clpmag.com and on all of the major social media platforms. So until next time, be well.